I look at it that way rather than say that's a very long gestational period.
And one most important thing which Sir told in yesterday's session, there's not a single unemployed doctor in this country or in this world. Once you finish your degree of MBBS, you will find job somewhere. It's only out of a matter of choice that people decide not to work so that they can study and crack the entrance exams. But trust me, if you're a doctor, you will always find work somewhere, you will always find patients to treat. And more importantly, just adding a bit on to what Sir told, the beauty of MBBS is that once you finish MBBS, you have a wide range of options. You can decide to study further and become a specialist and a super specialist. You can stop studying and just decide to work and become a good doctor. People have been there and done that. You can also decide that treating patients is not my thing. I just cannot handle treating patients, and then diversify into a totally different stream related to health sciences still. And those are the things we are going to touch upon. But I want to ask Kevin here a question. Many people do not even attempt an entrance exam in MBBS thinking that I think I'm an average student. Medicine is not for me. I cannot handle medicine because I have just scored 60%, 70% in entrance exams. I'm an average student. What will I do even if I get into medicine? I will just fail there. And many of them do not even attempt the MBBS entrance exam. Kevin, is that perception true?
Well, actually, no one is an average student. People only think they are average students. The problem in today's world is that a lot of people look at their marks in 11th and 12th and then decide what their career is going to be. But our advice to you would be that you find an area that you're interested in, and if you have found that area, you just go all out to get it. Because I believe that when you like something, when your interest is in something, no matter what stands in your way, if you want to get it, you will get it. So where there is a will, there is a way. So it doesn't matter what your marks have been all this while, it doesn't matter where you have been. But if you are ready to focus and give it your best from this point onwards towards a career that you want for yourself, then I can assure you that there will be no hardships in your way. There will be hardships, but you will be able to overcome them.
The most important thing is St. John's always takes 60 students per year in a batch. And let me tell you, the marks of my batchmates in their PU exams is something that if you think, my gosh, should I actually go to him as a patient? But the point here is that it doesn't matter what your marks in PUC are or what your marks even in MBBS are. What matters is how good a doctor you can become. I'm pretty sure if I ask the principal about what Ria, who is a third year student here right now, marks were in school, I'm pretty sure all of you will get into MBBS then, looking at what her marks were. But the point I'm trying to make is you just need to have determination and passion to get into MBBS. You need to crack an entrance exam. Your marks in entrance exam are important because that's the way you crack it. But your marks in PUC or whether you think you're an average student doesn't matter. Which brings to one more question regarding the field of medicine. I'm a multifaceted personality. I dance, I sing, I debate. I don't dance, I sing. I'm just thinking what students would think. I can dance, I can sing, I can do debate, I can do quiz. I'm a brilliant cricketer, footballer and all. If I get into medicine, will all this stop?
Definitely not. Because all of us standing here are involved in some extracurricular activity or other. Like for example, Nayan is involved in music and sport, and I'm involved in debating and quizzing. And Nitin here is obviously a very good speaker and he's involved in quizzing. So it doesn't really matter. The important thing is that a lot of people think that once I choose a professional career, I'm supposed to leave behind all my extracurricular activities, everything that I like doing, and just slog it out till I become something worth talking about. But that's entirely not true, because especially in a field like medicine, if you're going to sit and study for the whole course, yes, the subject is voluminous, but if you're going to sit and study the whole time and do nothing else, you will just erode. The very fact that we're standing here is proof that we've done something other than studying.
And the most important thing is that even speaking from a psychological viewpoint, the amount to study in medicine is just huge. The books are so heavy that in fact some of us use it as bodybuilding tools to impress the girls. It's huge, and the amount to study is huge. But then the most important fact here is that you need some sort of diversion. If you choose a day to go out and participate in a fest or participate in a sports competition, do not think of your studies. Go and do that. That's true even for the 9th and 10th standards as well. If you want to do something on a day, just go out and enjoy. But on the day you have to study, do not think about anything else. Just sit there and study so that you don't feel guilty about what you have done.
Yes, let's see how good quizzers you all are. Who are these? Come on.
Okay, we'll make it a competition between Capital Public School and Clooney School. MCC is not allowed into this. Okay, Clooney School wins it. This is Watson and Crick, the people who discovered the double helix of DNA. Genetics is a booming field right now.
So a lot of people ask, what exactly do you do when you become a geneticist? Now there are mainly two fields. There's the clinical field and the non-clinical field. In clinical genetics, as our division of genetics does in this hospital, they're mainly involved in diagnosing chromosomal abnormalities such as Down syndrome in children who are born or before they are born. And they're also associated with marital counseling or preconceptual counseling. In addition, they also impart education to students like us, and they will be doing for you soon once you go out to the stalls. In addition, genetics is also involved. You can also go into a field called molecular genetics, which is more related with the research aspect of genetics, where they study the basic molecular basis of disease.
One important question which especially those in the 11th and 12th standards have at this point of time is, do I do a BSc Biotech or a BTech Biotech? And what's the difference between the two if I want to be a genetist? The difference primarily ends at the point where you essentially want to be. Now BTech Biotech is an engineering degree. Now this degree is more suited or framed for an industry. Industry meaning we have the pharmaceutical industry where biotechnology is used for the manufacture of drugs, chemicals, enzymes. You have the chemical industry which is used for the enzymes and other stuff. And it's basically BTech Biotech is suited for the green biotechnology and the white biotechnology. BSc Biotech on the other hand is a more holistic degree which touches upon human genetics as well. Chromosomal mapping, gene mapping, genetic biotechnology, genetic counseling and all the other stuff. So you need to decide, do I want to finish BTech Biotech and end up in an industry and get a job right away, or do I do BSc Biotech and take the harder route of working in a hospital setup, or whether I want to get into an academic or a research field and do it more. So it's basically between an industrial field and an academic field. Now someone of you might ask, I want to become a doctor and I still want to become a genetist. That is also still possible, but the route is slightly harder and longer, because once you finish MBBS, you can totally change and again do BSc, MSc genetics. But the ideal thing that people have done is that do MBBS, do a post-graduation MD in either medicine or OBG or pediatrics, because these are the only three fields once you acquire an MD, following which you can do a DM genetics. So you become a super specialist genetics. But unfortunately, there's only one institute in this country which offers DM genetics, and that's the Sanjay Gandhi Institute, which is present in Lucknow.
Just adding to that, you might be wondering why we're talking about genetics and then telling you all a biotechnology degree. Well, that is actually because even though there is a degree called BTech Genetic Engineering, it's actually very rare and offered in very few sporadic colleges all over the country, which is why people generally take a biotechnology degree and then go into genetics.
How many of you are feeling hungry right now? Okay. If you're feeling hungry after seeing this delicious fruits out there, please patronize our food stalls which are present near the exhibition. This is a very cheap marketing trick which I just used. But coming back to the field of nutrition as such, Thomas Alva Edison once said that the doctor of the future will no longer treat the human frame with drugs, but will rather try to cure and prevent disease with nutrition. In fact, prevention is the theme behind MEDEX 2012. Nutrition, believe me, is a very upcoming field, and we are fortunate in St. John's Institute to have a separate division of nutrition.
Yeah. So again, nutrition is divided like genetics into industrial nutrition as well as clinical nutrition. Now clinical nutrition, like goes on in a hospital, they're mainly involved with creating specific diet charts for patients who have diseases like diabetes mellitus or other metabolic disorders that basically require a strict diet regimen. So what they do is they sit down with the patient, discuss what is the normal diet of the patient, and then try and induce as minimal change as possible to make sure that it's both easy for the patient as well as healthy. On the other hand, you have the industrial nutritionists, where all these high-end hotels require nutritionists for their menus and to make sure that the food they give is both healthy as well as tasty.
One important question here is that you need to have a basic life sciences degree before you can do anything in nutrition. So it's preferable if you have done PCMB, and more preferable, if you're coming from a PCMB background, it's much better to do a degree. And just to focus on the glamour aspect of nutrition. The St. John's Nutrition Institute is working with Pepsi for the last 3-4 years, and they are working on the molecular aspects of nutrition. Recently they entered into a collaboration with the International Atomic Agency and are doing some